Yo, good morning, everybody. This is Chris and Dr. Bunio. We're back to talk a little bit about COVID-19 and give some updates to things. Dr. Bunio, I know that the chief had recently put out a memorandum, I guess, for requesting people to be tested that are working in high impact areas, I guess, with the schools and daycares and such.
Right.
That kind of overflowed your system there for a minute yesterday. Can we talk a little bit about why it's important to call the hotline and go ahead and get that set up ahead of time?
Yeah, so there's a couple of reasons. First of all, if people will call the hotline, they can get through testing faster.
Okay.
The hotline is going to go ahead and do some of the preliminary work. They're going to put the order in. So that'll make that line go faster.
Okay.
And also, it helps us just kind of control the flow. We want to get everybody tested, but we don't want a big, long lineup. Nobody wants to be in a big, long line.
Right.
So it just allows us to control it so that people can get in, get tested, and get back home or wherever they need to go.
Okay. So especially with this week, we've got some testing later today, and we've got testing on Friday.
Yeah.
With everybody getting ready to return to work, and you know, things are spinning up a lot faster, and we're seeing some positive cases. It's very important, more now than ever, to go ahead and call the hotline, get your information out of the way up front.
Yeah.
And then go ahead and get your test set up for that day or whenever they schedule you.
Yep.
Okay, good. So if you're out in the public and you need to get that test done, call the hotline first. How long does it take when you're on the hotline? What kind of information are you going through?
It's just basic information. You know, they're going to want to, know your chart number. You know, they'll pull up your chart. They'll put the order in. It shouldn't take more than, 5 minutes.
Okay,
so.
good. And that'll save you time on the back end when if you just show up there, they're having to do the same thing, but it's much slower.
Yeah, because then they all have to do that face to face, in person.
Gotcha.
They have to go to one of the computers up there and put it in. So
Gotcha.
it takes a lot longer.
Good. Some more notes. The pharmacy does drive-through pickups.
Mm-hmm.
We're urging people to wear their mask if they have one at the pharmacy. Why is that important?
Well, like anywhere. And actually the pharmacy is starting to open up, some service through their waiting room too.
Okay.
So they want to make sure that, even when you're going through the drive-through, you're less than 6 feet away from somebody.
Right.
Right. So you want to protect that person by wearing your mask. You obviously want the pharmacy person should be wearing a mask. So, so it's just everybody protecting everybody
just a courtesy piece and make sure that we're protecting folks. We've got a lot of folks that go up to our elders, go up there quite a bit, and so we want to make sure that we're not spreading the germ if we have it by chance up there in the hospital area. Also, I'd seen this week, and I know a lot of what we're going to talk about today is in regards to wearing masks and why that's important and why we're trying to push our local community more so than anybody else in the country to wear masks. I saw an article and I've seen some comments made, I guess, regarding OSHA and some of the clarifications that they've had. Some of the folks out here are saying, it's not necessary to wear a mask, that actually could be more detrimental than good. Can we start to address some of that and make sure that the community knows what our understanding of that is and what our research shows?
Yeah, absolutely. So I saw that. I think it was a Facebook post or something. Someone had written some concerns that they had about wearing masks. And I just saw that this morning. I think we can start to look at some of that. I looked at the OSHA page this morning. Right. OSHA does recommend following the CDC guidelines.
Right.
So I did not see anything there that said that OSHA was saying not to wear masks.
Okay.
We've talked about this before. They're not perfect, but if everybody can wear a mask and wear a properly fitting mask, we can reduce the spread of the virus. So I think what we can do in subsequent meetings like this is I can do a little more research on the concerns and I can address them more directly. But right now I think it's important to tell the public that they should keep wearing their masks.
Right.
Obviously, we still want you to clean them, wash them after, each use. And just keep doing that. Do not stop wearing your masks until we give you that kind of guidance from, every infectious disease specialist in the country is advocating for this. So I'll do a little research because, I want to make sure we address any concern.
For sure.
But right now, I have not seen anything that says that cloth face masks are a bad idea.
Okay. And with anything, there's outliers. There anybody can make an argument in any single event. There was this, this person wore their mask, they filtered it with germs and got sicker. That's probably an outlier, though, when you consider the millions of people that are wearing them and preventing the spread of it right now. And so it's important not to just focus on that one little area when we have a big picture we're trying to manage here.
Yeah, I think like I mentioned before, everything we do, there's a risk and a benefit. But right now, we think the benefit of everybody wearing masks and out in public far outweighs any risk.
Right. Okay, so let's jump into it. Do all patients and visitors coming to the hospital need to wear their mask at this time then?
Yes.
That's an easy one.
I think we covered that one.
We did. So I still don't understand why we're wearing masks. Why is it so important? Does it really reduce the risk of exposure?
Okay. It does. And in particular, it reduces the transmission. So when you wear a mask, if you are one of these people who you got the virus but you don't know it because you don't have any symptoms, you feel perfectly fine.
Right.
It stops you from spreading that virus to somebody next to you who may be more vulnerable, who may be an elder, who may be a child or somebody who's immunosuppressed. We do know that these cloth masks, they help prevent the spread. They don't protect the person wearing them as much, but it just depends on how well constructed your mask is. Again, you want to make sure the mask covers your nose. Ideally, it goes under your chin and fits to the sides of your face. You want the air to go through the fabric,
not around
it. And then you do get, when we talk, we are expelling little droplets, and the mask catches, not all of them, but a large number. You have to have a medical grade mask to actually, get up to the over 90% capture, but every little bit's going to help here.
And that's what we're after. We're not trying to just put something on our face to stop this completely. I mean, we're just trying to reduce this as much as we can and stop the transmission as much as we can at this point. And that's the purpose of the mask, is to keep you from expelling it directly in somebody while you're out in public. Let me ask you this. The test that they're issuing, has it switched over? I know we talked about this a long time ago. Are they doing the 2 swabs in each nose, 1 deep? How?
They should just be doing the one.
The 1 swab now?
Yep.
Okay.
Yeah. And we're still using the same tests. We're constantly looking for better testing, faster testing that comes back earlier. If we can get it, we are going to get it. But everyone around the country wants the same thing right now.
Right. So in giant bold letters, why do we have to wear a mask in public?
Well, I think we covered it, but you wear your mask in public, particularly in places like the grocery store, where you cannot guarantee that you are going to be 6 feet away from somebody the whole time. And again, follow the lines. Now everything's one way. Follow those, so you're not going face to face with anybody. If you're outside, and at the park, with your dog, or you're on a hike and you don't think you're going to meet anybody, you do not need to wear a mask there. It's just sort of common sense. But I had to go to Asheville the other day, and I noticed there was a lot of people there wearing masks, just because it's so much more densely populated. They can't guarantee that someone's going to come around that corner and be right in their face. So there's a lot of people in Asheville I saw wearing masks, and I think that's a good thing. Good.
So is wearing a mask the new normal?
Yeah, it is. We're not used to it. Summer's coming. It's getting hot. It's uncomfortable. But this is going to be the new normal for quite a while now. That may change. If we get a vaccine, that may change things. But for now, get you a couple of masks so you can, everybody's starting to get a little collection, so you can wash them, and wear a different mask. You have one in each of your
cars yet?
I've got a couple. Well, I only have one car.
Oh, okay.
But but I do actually have about 2 or 3 masks, in the car, and I think they should invent a little hook that I can hook them on.
That'd be cool. Yeah, and they can hang in the sun when you're inside working or something and kill some of the germ. I was going to go to that one. We'll get back to it.
Okay.
The new normal, wearing masks. I was going to ask, that's what it was. If we have to go out and we're wearing our mask but others aren't, what's the risk there?
Well, you're protecting them, but they're not protecting you.
Okay.
So the risk is, so again, it's kind of like, I think I mentioned once before, I lived in a big city. There are certain places I knew not to go. if you see these danger signs, you see a lot of people not wearing masks, and if any of them coughs or sneezes, turn around and go the other way.
Right.
I mean, I don't think anybody does that on purpose, but sometimes, people are just minimizing the risk. They think it's not going to happen to me. I'm not infected.
Right.
I'm not going to spread it. But if you're wearing your mask and they're not, try to give that area a wide berth.
Gotcha. It's much the same reason I don't go to Walmart. It's not because I don't like Walmart or the people that visit Walmart, but it's because I have to pass a Dunkin' Donuts on the way, and I can't resist pulling in and grabbing me a donut or 6.
That is really
10.
smart. And the lineup at Dunkin' Donuts has been really long lately.
Has that not been absurd?
Are they still giving free donuts to healthcare workers?
Ooh, I don't know.
Shiashi, can you check on that for me?
Yeah, we need to know if that's the thing.
Okay. Yeah.
But yeah, I love Dunkin' Donuts, so I just try not to visit that area because I can't not get 10 of them, and I like the little munchkins.
That's good advice.
So are masks only good for those who are sick to not help spread germs? I know we just talked about that. How will me wearing a mask and not being sick affect anyone?
Okay. So masks are especially a good idea if you're feeling sick, because you won't spread germs. Ideally, if you're feeling sick, you should stay home.
Right.
Now, the mask is not a substitute for social distancing and staying at home, just staying away from other people.
Gotcha.
But if you are sick, if you have to go out, wearing a mask is particularly important. We know that asymptomatic people spread this virus, but if you are symptomatic, you are also spreading the virus just as much. And you wearing a mask when you're not sick, that's that situation we've talked about many times. You got the virus, maybe you're pretty healthy, you're not feeling it. You don't even know you have it, but you're spraying out the germs. So you wearing a mask when you're not feeling sick just helps other people around you not catch it, helps the community.
Gotcha. What is the right way to wear a mask, and how do I adjust it properly?
Okay. So as I said before, you want to make sure it covers your nose. If you have a mask that has a little metal piece so it can sort of form around your nose, that's a good idea. You want it to fit as tightly as possible around your face. You want to make sure if it goes under your chin, that's a little bit better. And it should fit as tightly to your skin as possible. You want your breath to go through the fabric and not out the sides or up top. So it's hard to do with cloth masks.
Right.
They don't fit perfectly, but some of the medical grade ones, they just seal right up against your face. Everything has to go through the material. So that's the right way. If you have to adjust it, so the mask can become contaminated either, from your hands to the mask or just you being out in the world. So we recommend that if you do have to adjust it, you sanitize your hands, make your adjustment, sanitize again after that, and then you're good. Normally, you want to try not to touch the mask, either the interior or exterior surface. Handle it by the ear pieces if you can.
Okay, very good. When can I take my mask off after I leave a public area?
Okay. So I think we answered this one, and I'm going to actually change my answer because I said, I take it off, pretty soon after I get out the store. But I realize that really what you should do is sanitize your hands first.
Gotcha.
So as soon as you get out of a public area, maybe you got some hand sanitizer in your pocket. I keep mine in my car. So I wear it until I get to my car, sanitize my hands, then I take it off, and then I hang it up.
And I mentioned this before too. If I visit the post office, and some things you just have to do. You have to go to the post office. You have to go to the grocery store. You have to do certain things. When I get back in and I sanitize, I also hit the door handles and the steering wheel because I usually touch them at some point.
Yep.
And I just want to make sure if there's anything lingering on those surfaces that I try to kill that as well while I'm sanitizing. So
yeah, that's a good idea.
Wipe around everything you have there. I'm in a meeting at work and we're more than 6 feet apart because of social distancing. Is it important to still wear a mask?
Yes.
Okay.
And the reason for that is these droplets that are coming out. If you're not wearing a mask, there's going to be this sort of cloud of droplets around you.
Right.
Some of which are going to take, some of them drop to the floor very quickly, the bigger ones. They're not thought to go more than 6 feet, but they are going to hang in the air. So it's when people pass through that space after you're gone. So that's why wearing the mask is still important. If anybody is coughing or sneezing, they're probably going to propel droplets beyond 6 feet. So that's, again, a big warning sign.
Gotcha.
Especially sneezing. Sneezing actually generates a lot of force.
A lot of force.
Yeah.
And I mentioned that last week. Like, I blank out for just a second. Like, I see stars. I black out. I sneeze like nothing I've ever seen before.
Okay.
We might need to talk about that further. It might be another issue.
We'll run some tests.
Should kids wear masks and cover their faces?
Yes, they should. Hopefully you can make it kind of like a game for them, or tell them they're
Ninjas.
Spider-Man or Batman or something. Well, Batman didn't wear a mask.
Yeah, he
just the top part,
that's right.
So his sorry about that.
That's right. His mouth was open.
Yeah, so maybe
actually he had the wrong thing going on, didn't he?
He was totally bad. So,
wow,
which is crazy.
I just realized that. Yeah, Batman's whole mouth area was exposed. I mean, that's totally a terrible.
And
spot.
this thing came from bats.
Nice.
So he would have been. Like,
he should have known more than anybody.
Big trouble.
Oh, okay. Kids, choose a new superhero. Then how do you protect kids under the age of 2?
Okay, so that's a good question because, as we've said before, you should not be putting a mask on a child who's under 2. The best way to protect them is don't take them into high-risk areas, congregate areas. Try to keep them at home as much as possible.
Right, and I know that we can't necessarily speak to this, but the daycares are opening back up soon. We're going to have a flood of people coming back to work, back into the child care systems. More than ever, is it important to just start watching your children, like to when you get home, just evaluate, temperatures, check for any symptoms or anything like that? What should a parent of a child that's attending school be watching for when they come home with them? Yeah,
any signs of illness. Ideally, you should really check the child before you drop them off.
Okay.
Because if they have any sign of a fever, if they're not feeling well,
right,
you do not want to put that child in with a bunch of other children.
Okay.
So checking your child before and after. When we're monitoring people that work at the hospital, we say check your temperature twice a day.
Okay.
Any sort of signs of illness, cough, shortness of breath, of course, sneezing, runny nose. It's going to be tough because kids get sick.
Right.
And kids in daycare, they tend to get sick a lot too. So there's a lot of these real mild viruses. But right now we can't tell the difference. So it's better not to put them in big groups together. And I think the daycare is taking measures to reduce that risk.
Right.
I know we've tested everybody, that works there.
Right.
So I think they're doing the best they can, but as a parent, I would want to just keep a real close eye on my child.
It's very important that you watch your child, check the temperatures. I think Amazon sells like a one you can just rub across the forehead, maybe.
Yeah, I've seen those. There's little strips you can put on.
Yeah, so I look for some way to check temperatures pretty regularly that's safe and doesn't involve too much.
Yeah.
How often should you change your disposable mask?
Well, after each use, you should probably dispose of it because you can't really wash those.
Okay.
Are
they and when we say disposable mask, are we talking about the blue looking thing?
Yeah, they're lighter. They're a little bit easier. Usually they're blue.
Okay.
Some of them just have these ear loops.
Okay.
Others some of them you can tie, but
right.
They're really just made for a single use. So you can't, once they're out, there's a potential that they're contaminated. You should probably throw them away.
And because of the nature of the fabric, they're not designed to be cleaned and washed.
No. And we've mentioned that, some kind of mask is better than no kind of mask. So if you had to, if you're making multiple stops and you're going to have to use it, if you're really careful, that's probably okay. I'd hate for someone to burn through, 5 or 6 masks just doing all their errands. But yeah, they're not going to hold up to any kind of cleaning. So you're going to have to change it after a single use.
Gotcha. And what do we do if we wear a mask in public? Do we wash it when we get home?
Yeah, you need to wash it. I mean, you don't have to wash it immediately if you can put it in an area. So what I do is I take all the masks I've been wearing for the week and I put it, I store them somewhere. A paper bag is really a good thing. And then somebody washes it for me. I don't wash it myself.
Mysteriously, it
and
gets
then they're
washed.
clean.
And they're clean. I'll wear them again.
I put them back on. But recommendations are to wash them consistent with the fabric. as warm water as the fabric will tolerate.
Yeah, I was going to say treat them like a pair of underwear, but I'm not sure that you want to wear underwear twice in a row, so that wouldn't kind of be the same
Yeah, I
thing.
think we'll have to find a different analogy.
Yeah, I need a better one.
Yeah.
Treat it. We'll work on.
Treat it like something you wash after you've worn it.
Yeah, exactly. Are we overreacting? Masks just seem a little bit much.
I don't think we're overreacting. All you have to do is look at, different areas where they don't, parts of the world that don't have the health system we have, and Brazil's, was really
Right.
struggling. To see how quickly this thing can get out of control. The best thing that can happen is we look back on this 2 years from now and say, boy, we overreacted, didn't we?
Yeah.
But if it gets bad,
We save lives doing that.
we do, and there's no way to go back. So once this thing gets out of control, it's really hard to contain it. Again, just a plug for the people that are doing the contact tracing for us. If they give you a call, say, hey, you might have been exposed to
Right.
someone, answer the call, take the advice, follow their guidance, because we've actually had some success in controlling what I thought were going to turn out to be really bad situations. And it's because people were listening, and they did what the contact tracing team told them to do. So I want to congratulate the community. Now, we're not out of the woods,
Right.
but if, listen, we're all at risk. Any one of us could be exposed.
Right.
We just have to do what's right. Stay
and
home.
you don't even have to look abroad really either. We mentioned this last week. We have some native communities right now that have really been just hammered hard. I mean, the Mississippi Choctaw continue to read articles about past leadership and spouses of leadership that have passed away from this, grandfathers and fathers and brothers, and it's really tragic. It's hitting some areas of the country really, really hard, and especially in native communities. And so we don't have to look far to see that this is a real thing. I know that there are some hot spots too popping back up. I know that we're not here to get into the minutia of the politics of it all, but Myrtle Beach, South Carolina had recently posted on one of the news articles there that there were some closings of some restaurants that had tested positive. Some of the food staff had.
Yeah.
And so if you've been to Myrtle Beach lately, I'd say to look up that article and take a peek at some of those places. Make sure if you dine there that you go ahead and get tested just out of safety, I guess.
Yeah.
We're not trying to create panic here, but certainly look at the articles out there that folks have seen put out there with positive tests in some of these high traffic areas, and make sure that you're protecting yourself and your family.
Yeah, it's not surprising, but it's kind of, in many cases, that's too little too late. I mean,
Right.
if hopefully the wait staff in those restaurants were wearing their masks. There was also that report about that hairstylist who had, I think, 150 customers.
Oh, wow.
And she wore a mask, and none of her customers tested positive.
Wow.
So we have, so far, knock on wood, we have not had any cases where a staff member at the hospital caught it.
Mm-hmm.
But we wear our masks all the time.
So even if it was to happen,
masks work.
they're working.
Yeah, and we're seeing that. So I've seen other health systems that have had little groups of healthcare workers catch it, and we think it's because they took their masks off when they went to the break room.
Okay.
They didn't catch it while at work.
Right,
They took it when
right.
they took their break and forgot what
And
they
it's
were
a small
supposed
little
to be
thing
doing.
like that, right?
Yeah, because
good.
everybody can be infected.
Well, it's important now more than ever, as things are reopening here locally, and this is a message really for the community. Things are coming back to work. People are starting to move around again. It's now more important than ever to do our part in that. And, we talk a lot about leadership, and we look to leadership to answer the questions or answer the problems. This is beyond leadership, and in a lot of ways, what we take for granted is that we're all leaders of some kind. We're not all, it isn't just the doctors, the chiefs, the council members that are our leaders. It's us. The leadership comes from the community. It comes from us. Every one of us, whether we admit it or not, or want to see it that way, impacts somebody. Somebody's looking at us. Somebody's watching what we do and listening to the words that we say. And those actions exponentially create a whole vacuum of what our community is. And so if you are telling people, like, I don't want to wear my mask, people are listening, and you're spreading that. And it's important now more than ever. You have the opportunity to put that power in your hands to say, let's protect our community. Let's do the right things. And this isn't just about this virus. This is everything. Let's eat healthier. Let's treat each other better. And in all that message, we're all the leaders that are going to drive this as a community to protect our elders and protect each other. And so this message about wearing your mask is all we're asking. Wear your mask, stay 6 feet apart. We're not asking anymore, but it involves our whole lives. You can do a lot more with that power and sharing that with the peers that you have, your children. Somewhere out there, there's a 4-year-old that's listening to you make these comments. Be aware of that because you're creating their future. Be aware of yourselves and the things that you're saying and the things that you're doing, because we can do better. We can really turn the tide on this thing and keep it out of here. And not just the virus, we can make our whole community better in doing these positive movements. And that's the Cherokee way. That's what we should be doing. Learning our culture, learning our language, learning the values, and this is just one of them. This is if we do those things, this piece right here is easy. And so thank you for coming on again. Yeah. Thank you to the public. I really wanted to thank your team. I wanted to thank everybody in healthcare, everybody out in the community that's putting themselves out in the front lines. I work on the Joint Information Committee, the JIT committee. All the folks that are on that have great ideas, have been trying to get the information out there. The signage is coming. Everybody's working. Everybody's doing their part, and I want to thank those individuals and those teams that are doing that, because sometimes it isn't very rewarding. It's not a thankful kind of job, but thank you. That does mean a lot to the community, I'm sure, and so for the general public, keep doing your part. Dr. Bunio, we'll chat again in a week and answer any further questions. If you have any more questions, post them on the Facebook page, and we'll get right to those. We'll see you again in about a week. Data Dog, how are you?